My topic was on safety and efficacy of the transobturator tape for stress urinary incontinence in female. Urinary incontinence is a common distressing condition which affects women on all ages, and it can have profound impact on the quality of their lives. Literature describes more than 200 types of procedures for its management, and TOT have been widely accepted as the primary surgical management for SUI. Following an increasing number of women presenting with multiple complications after mesh surgery requiring a secondary surgery for its removal, many countries including England and Wales have banned mid-urethral sling surgeries since 2018. In our practice, TOT is very common, but mesh-related complications are not encountered routinely. So we wanted to conduct a study to assess the long-term outcomes and adverse effects of TOT in patients from our population. Aim was to assess the safety and efficacy of transobturator tape for the surgical management of female SUI, and objectives were to assess the improvement in the quality of their life, to look for intra-op complications and post-operative complications including mesh erosion, infections, urinary retention, dyspareunia, and recurrence over a period of 5 years. We used a retrospective observational study on 35 patients who underwent TOT procedure with polypropylene mesh from 2012 to 2017 under the Gynecology and Urology departments of Amala Institute, Thrissur, and they were followed up over a period of 5 years and were approached with a definitive questionnaire, and the responses were recorded and analyzed. Coming to the results we obtained, majority of our patients presented with mixed incontinence with predominant stress urinary incontinence symptoms, and only one of our patients had an intra-op complication of bladder injury, and it was repaired immediately. Coming to the post-operative complication, all the complications including infection, erosion, retention, recurrent UTI, dyspareunia, and mesh removal were less in our study compared to the European counter studies, and mesh erosion and recurrent UTI were significantly less. Time taken for the initial relief after the procedure, 85.7% of our patients received an immediate relief, while the rest received relief within a period of 1 month, and this is the same for complete relief also. Symptom-free living, 100% were living symptom-free for a period of 1 year. By the end of 1 year, 94.3%, and by the end of 5 years, 62.9% of patients are living symptom-free. Coming to their quality of life after 5 years, all 63% are better, 15% are complaining of stress symptoms now, 12% on urge symptoms, 3% mixed incontinence, and 3% are complaining of retention. So to conclude, our study confirms that TOT is a safe procedure in the short and long term with very few intraoperative and late post-operative complications, and it is effective and successful with 63% of cured and the rest improved patients during the 5-year follow-up. This was my poster. Thank you.